How do doctors accurately diagnose dry eye causes? Imagine trying to fix a puzzle without seeing the full picture. That's why doctors use a detailed approach to figure out what's causing dry eyes. They start by asking about your symptoms, overall health, medications, and environment. This helps them understand what might be contributing to your dry eye problem. For example, certain medications or environmental factors like wind or dry air can make symptoms worse. Next, they measure how much tears you produce. One common test is called the Schirmer's test. A tiny strip of special paper is placed under your lower eyelid for about 5 minutes. If less than 10 millimeters of the strip gets wet, it suggests your eyes aren't making enough tears. There's also the phenol red thread test, which uses a small, pH-sensitive thread placed on your eyelid for 15 seconds to quickly measure tear volume. These tests help determine if your dry is due to insufficient tear production. Doctors also check how stable your tear film is. They use a dye called Fluorescein, which is placed in your eye. The doctor then watches how long it takes for dry spots to appear on your eye's surface. If these spots form quickly, it indicates your tears are evaporating too fast or your tear film isn't holding together well. They may also measure tear osmolarity, which looks at the concentration of particles in your tears. Higher osmolarity means your tears are more concentrated, often a sign of dry eye disease. Another important step is examining the surface of your. Using dyes like fluorescein or lissamine green, the doctor looks for damaged or dying cells on the cornea and conjunctiva. Brightly stained areas show where the surface has been harmed by dryness. Sometimes, they use a microscope to look more closely at the eye's surface, checking for inflammation or epithelial damage. In some cases, they test for inflammation markers in tears, such as matrix metalloproteinase 9. Elevated levels of this enzyme can suggest ongoing inflammation related to dry eye. Since the meibomian glands produce the oily layer of tears that prevent evaporation, doctors may also examine these glands. They look for blockages or changes in the gland secretions, which can cause evaporative dry. All these tests together give a complete picture of what's causing your dry. They help the doctor decide whether your dry eye is mainly due to not enough tears, too much evaporation, or a combination of both. This detailed diagnosis is essential for choosing the right treatment, whether it involves artificial tears, eyelid hygiene, or other therapies. It's important to remember that each person's eyes are different, so a personalized approach is key. Always consult an eye care professional for an accurate diagnosis and tailored treatment plan.